All right, everybody, we're going to start with the big nose model here. And I just want to draw your attention to the fact that this is a human head. This would be the outline of the outline of the nose, the lip, and then you have the front of the head. In fact, you see the two sinuses here, your frontal sinus and your sphenoid sinus. And you can even see a little bit of peeking of the olfactory nerve sitting on the cribriform plate up there. So this is going to be your heart palate here, right, which is sort of the roof of your mouth. And you can see the structure here is going to be your soft palate, and it terminates at this uvula, right, which hangs down. This whole structure here is going to be your nasal pharynx, or sort of like the very tippy top of your throat, your nasal pharynx here. And this opening that you see within this pharynx is going to be the opening of the eustachian tube. And so this tube is going to carry fluid from your middle ear all the way down the tube through this opening and down to your throat. This sort of ripply or cobbled structure here is going to be your pharyngeal tonsil or your adenoids. And so you feel free to use on the exam, you can feel free to use adenoids or pharyngeal tonsil. So this structure, these little thin bones here are going to be what are going to contribute to the shape of your nose. In fact, this is your septal cartilage, which is sort of the cartilage that's between your two nostrils, right? And this structure up here, this bone is going to be your perpendicular plate and vomer plate, and that's really important to know. So just make sure that you know that this bone up here is going to be your perpendicular plate, and this is your vomer, right? So perpendicular, and then perpendicular plate, and then the vomer. Okay. Okay, so now let's move the bone and cartilage away. And underneath, you're going to have these concha. So concha 1, concha 2, and concha 3, right? So this is going to be your superior concha, middle concha, and inferior concha, right? Yeah, and so just know that. And sometimes they may be called turbinates, but just kind of keep them as concha. So superior, middle, and inferior concha. And then this whole structure here will be your nasal cavity. The opening, or I can kind of put it this way, this opening here will be your anterior nair. And another word for nair is just nostril, right? So, all right, so I think that is it. Hopefully that's been helpful.